This video covers core exercises that you can do once you're past the 6-week mark after breast cancer surgery. If you haven't seen the first video, which covers exercises for weeks 2 to 6 after surgery, that's a good place to start. These are some of the exercises that I incorporated into my routine when I had low back pain after my double mastectomy and reconstruction surgery. Hi, I'm Erica. I'm a breast cancer thriver and a chiropractor. After the 6-week mark after surgery, I found there's more flexibility to get into some different positions for the exercises. You'll also find that you can bear more weight on your hands and be able to engage your shoulder muscles more. I purposely didn't include exercises where you'd be lying on your stomach, as I find most women at this stage don't feel comfortable in that position. There are 5 exercises included in this stage of core exercises. The first exercise is a plank. You can set yourself up on your feet and then either have the weight on your hands or your forearms. Both are great options, so I would alternate between the two each time you do this exercise. You can hold this plank position until you're fatigued. The timing will vary quite a bit, but try working your way up to about a minute. You shouldn't feel any low back pain when you're doing this exercise. With fatigue, there's a tendency to raise the hips up higher, as it does make this exercise easier. Some people also allow the hips to drop down too far. Try your best to keep a rigid body as you're holding this plank position. It's also common to collapse or sink down a little bit through your shoulders. So you want to try to push your body away from the floor throughout this movement. If you had breast reconstruction with tissue expanders or implants placed under the muscle like I did, you may find that this position feels a bit weird. There's a decent amount of pec activation or chest muscle activation as you're doing this exercise, so you may get some of that animation where that implant just shifts a little bit as you're holding this plank position, contracting those pecs. The second exercise is a side plank. You're going to set yourself up lying on your side with both legs bent, feet pointing back, and then your knees are flush with your body. Place your elbow or forearm on the floor and then raise your body up. You can hold this position to fatigue, again working your way up to about a minute. You'll want to ensure that your elbow isn't too far out, as this can aggravate your shoulder, so try to keep your elbow directly under your shoulder. This exercise should be pain-free in your shoulder area, and if it's not, it just means that you're not quite ready for this exercise. A variation on this exercise is starting out in the same position as before, but the top leg is straight rather than bent. You can hold this static position just like the last one. Your top arm can either be in the air or down at your side. Another option is starting in the same position as the previous exercise, but this time you're going to slowly move your top leg up and down while you're holding that static side plank position. You can raise and lower that leg about 10 to 15 repetitions. The third exercise is a hollow rock. This is definitely more advanced than the previous 2 exercises. You can start off with a bent knee position and see if that works for you. You're going to rock back and forth, keeping your body rigid throughout this exercise. If this is too much of a challenge or your back is sore doing it, I would focus on the other core exercises and then try this again in a number of weeks. The next progression is doing hollow rocks with straight legs, and your arms are going to be at your side. You'll roll back and forth, keeping a rigid body that looks like a banana shape. The next step is bringing your hands crossed over your chest. Once this is easy, you can then place your hands behind your head. The last progression for a hollow rock would be to do it with your arms up straight overhead. The next exercise is a bird dog, and you can start on your hands and your knees on the floor. The first progression is to raise one arm up with your thumb pointing up as well. Hold 5 seconds and then lower back down. Repeat the same movement with the other arm. Next, you'll raise one leg up, keeping it straight. Hold for 5 seconds, and then lower it back down, and then repeat again with the other leg. This is a great exercise to work on stability of the shoulder, which is important to regain after breast cancer surgery. It's also helpful for strengthening your low back. Once this gets easy, you can progress to lifting your opposite arm and opposite leg up together. You would hold up the top again for 5 seconds, lower back down, and then continue to alternate sides for 5 to 10 repetitions per side. In an effort to raise your arm and leg higher, some people will arch their back. Do your best to keep your core tight and maintain more of a rigid body. Are you finding these exercises helpful? If so, consider subscribing, as it really does help other women find this information. The last exercise is a side step with a band. You can use one of those long TheraBands and tie a knot in it just to make a circle, but I do find that those ready-made circular bands work really well. You're going to place the band just above your knees. While keeping your knees slightly bent, step out to the side to create tension on the band, and then move your other foot so that your feet almost meet back in the middle. You can step in one direction for 15 to 20 steps, and then back in the other direction. You should feel the side of your hips working as you're doing this exercise. Try to avoid having your knees migrate inwards as you're doing this exercise. You want to try to keep them in line. You can think about pushing your knees out on the band with each step to accomplish this. A variation on this exercise is stepping forward and back in more of a diagonal pattern. You would take diagonal steps moving forward, again about 15 to 20 steps, and then do the same thing stepping back diagonally. You can take wider steps with this variation. Thanks for watching, and we'll see you in the next video. If there's any other topics that you'd like me to discuss, let me know in the comments below.